meeting. And also I'll share my screen and introduce Kabha to Samantha, because this is your first time coming here, right?
So, it is a pleasure. I'm excited to be here.
Okay. Welcome everybody to the Kabha bi-monthly meeting. These days, we actually don't have a bi-monthly meeting, but we have a quarterly meeting. So I'm so ashamed of myself, but we will be changed. It will be changed because our COVID pandemic is almost over. It's changed into endemic, right? So it's time for us to be back to normal. So I believe we will have a bi-monthly meeting again. Okay. So welcome everybody. Korean American Behavioral Health Association, Kabha. We are non-profit organization established in November 2001. So it's been 21 years in New York and New Jersey. Kabha has served the Korean community by providing free workshops, writing articles in Korean newspapers and magazines, and appearing on Korean broadcastings. And Kabha has been involved in numerous research projects and NAMI, a support group for families with mental illnesses, to advocate for the Korean community. And our vision is to provide effective resolutions to the issues regarding public awareness, education, and prevention on mental health and disabilities within the community by cultivating, connecting, and supporting mental health professionals and special education specialists for Korean Americans. So Kabha members are all mental health professionals, psychiatric nurses and psychiatrists, licensed clinical social worker or licensed social worker, or doctors, and also art therapists. There are many other mental health professionals. Members. Actually, we have three. Now we have three executive committee members. But we usually have 4 members, so we will recruit more, one more executive committee members. And we have now, I believe, 6 board members. Not all of them came today because they have a conflict in their schedule, but we'll see. We hope to see them again next meeting. Membership fee. You don't have to know semester, but we have a membership here. Before we move on, so we have an announcement for the next upcoming events. So I believe it will be held either the last week of September or the first week of October. It will be decided soon, and I will send out email by the end of next week. Okay, so the upcoming events, bi-monthly meeting and special presentation. Special guest speaker is our own valuable member, Hyung-ji Kim, PhD candidate in clinical psychology. He's from Long Island University. The title of presentation is Trait Mindfulness in the Context of Borderline Personality Disorder, Features and Perceived Relationship, Quality in Romantic Couples, a moderated mediation approach. Vice versa. Is it mediated? Sorry about that. So
No worries.
Hyung-ji, you are here.
Yes, I'm here. Right, so I've used actually a moderated moderation approach, which is slightly different from moderated mediation, but that's something I will discuss in the meeting. Please look forward to it.
Okay, sounds complicated, but it's very interesting, right? So I'm expecting your presentation within 2 months. Hopefully, I want to have your presentation soon in September or early October. And these events will be held both through via Zoom, and it's going to be in-person events. So if members want to come, you can come to Naya College to Washington Street in New York. But it will be decided soon. So I will send out detailed information soon. Okay. So I'm so excited to meet our Kabha members in person. It's been a while, right? So I'm so excited. Okay, this is my announcements, and let's move on. Now it's time for us to move on to today's subject. All of us research program. Long story short, I received an email from Asian Health Coalition regarding the opportunity to become a partner of the NIH All of Us research program in order to help underrepresented communities like Asian American, Native Hawaiian, and Pacific Islander communities by recruiting them for the this research program. So Asian Health Coalition launched the Asian Engagement and Retirement Corps to lead community discussions and provide input on all of us engagement strategies and educational materials. That's why they sent out email to various type of organizations, including Kabha, right? So our executive team reviewed the opportunity and found that we can earn that stipend for a partnership. So we applied for the event, and we are selected. So on behalf of Kabha, I participated in the training in July 4 times, and we plan to hold this webinar as a contract, right? So now, Samas, it's time for you to take over.
Thanks, Moon. And I'll actually be sharing my screen.
I'll stop sharing mine.
All right, let me know if you all can see it along the large screen version.
Oh, introduce yourself, because I'm recording this, and common members they don't know about you.
Okay, all right. I'll reintroduce myself. I know Moon knows me. Hello, everyone. I'm Samantha Dion. As Moon had mentioned, I am part of the Asian Health Coalition. I'm one of the program managers over the All of Us Research Program. All of Us Research Program is under the National Institute of Health. So actually, my department is working at the University of Chicago Medicine. And I'll kind of go into some background on just the infrastructure that we're working with. So the Asian Health Coalition, along with the UCM Center for Asian Health Equity, they came about for these 3 reasons that you see listed on this screen. In the Midwest specifically, big absence of a lot of Asian immigrant health research. So including that and coupled with that, just having the highest population growth rate in Illinois and the US, Asians and specifically immigrants are increasing at a very, very high rate. And then including with that, just the lack of health systems addressing a lot of Asian Americans and African immigrant needs. So that is essentially the birth of Asian Health Coalition and the Center for Asian Health Equity. Asian Health Coalition specifically working on the engagement and the education activities, reaching out to the community in that way. And then Center for Asian Health Equity is our arm for specifically on research. So we work with professors in the Chicago Midwest, US actually, so professors across the US as well on research and working and pushing papers out there. And I think what's beautiful about this is a lot of research is done, but working with community-based organizations and understanding their needs and coming up with solutions, not only with just pointing out the problems, but coming up with those solutions with community-based organizations, with the Asian Health Coalition, with that engagement and education piece. So that's just some background on the Asian Health Coalition and the Center for Asian Health Equity. And again, we work in the University of Chicago Medicine. And one of our big programs is the All of Us Research Program. So these are just some of the other programs that we work with. Mental and behavioral health, which is something that Kabha has a focus on. So if you want to share any materials there, we're happy to do that, especially now that we have a connection and relationship with each other. And then, like I mentioned, the precision medicine piece, increasing Asian Americans, Native Hawaiians, and Pacific Islanders participation in the All of Us Research Program. So what is the All of Us Research Program, and why is it important for Asian Americans, Native Hawaiians, and Pacific Islanders? So this training, Moon had went through the various trainings that we had done. This is just the first piece of that training, designated to just give some background on the All of Us Research Program. And for all of you on this call, Asian Health Coalition is dedicated for the engagement and education for Asian Americans, Native Hawaiians, and Pacific Islander communities, to create culturally and linguistically appropriate ways to reach out to these communities. So while we focus on AA and HPIs, there are other arms in this NIH program that is focusing on other marginalized communities, such as the African American community. So there is a community engagement partner, community engagement partner that focuses on them. There is a partner that focuses on the Latinx community, and so on. So there are a few other community engagement partners that focus on these specific pockets of communities that need to be represented in research. So this is just the agenda that we'll be walking through today. Again, going through what is the All of Us Research Program in precision medicine, how does it work and why it is important, and then just research that provides more insight on these disparities, and then just an open discussion if anyone has open questions or Q&A on the program, or any comments. But I did want to have a time check, Moon. When do we have a cutoff? I want to be cognizant of everyone's time, and also if you had other notes that you wanted to go through at the end of the call.
Yeah, we don't have any other issue that we have to talk. So I think you have 1 hour, one hour to 1 hour.
Okay, great. Good to know. All right. So I kind of met everyone already. I think my next slide is just introduction. So I'll actually just skip over for those that I did not get to. I think there were a few people that didn't get to introduce themselves. Maybe if you wanted to type it in the chat, or if you wanted to unmute yourself, feel free to just say your name, preferred pronouns, and maybe what you do. I had a question here, what does health mean to you? But feel free to add anything else. I think I saw an Irene on the call. I don't know if you're able to unmute yourself, or if you wanted to just use the chats.
Hi, Samantha. This is Irene. Nice meeting you.
Nice to meet you. Happy to have you here. All right. I've met everyone else. All right. So what is the All of Us Research Program? As I had mentioned, this is a research program under the National Institute of Health, and the ultimate goal is to advance precision medicine. And again, what is precision medicine? This is actually a new topic, quite a new term in research in general. So the ultimate goal of the All of Us Research Program is to accelerate precision medicine, and precision medicine is the emerging approach for disease treatment and prevention that takes into account individual variability in lifestyle, environment, and biological makeup. And that can include various things when we say lifestyle, environment, biological makeup. Lifestyle can be any cultural practices or cultural daily activities that you may have that are different. And that can include, diet. A lot of people have different diet practices depending on your culture. Environment can include whether you live in the rural area versus a more urban area. And then, of course, your biological makeup, your genetics, your DNA, all of that's passed down from ancestry, that can be affecting the type of treatment and prevention that is needed for you as an individual. And the All of Us program is essentially taking all of that into account to create that treatment, that prevention specifically for an individual. Because right now, a lot of health systems or a lot of preventment and treatment is a very one size fits all. That's currently how our health system is set up. And with precision medicine, it is trying to take into your individual factors to create a treatment and prevention that is suited for you specifically. So how does the program work? So we do have other sessions that go into more detail on what entails on how to sign up and what is needed to stay with the program. But this is just at a high level. Participants will share their data that can include filling out any surveys or providing biospecimens. And that next step is wanting to allow people to know that your data is protected with the NIH. There are various walls that are in place so that your data specifically is not given out to anyone or used in a terrible way. And then that next step, researchers will use that data to study it, come up with various papers or using that data to come up with any solutions that they had seen from any of the surveys or biospecimens. And then in return, participants get that information back, kind of like that, I forget what it's called, the Me in 23, where you got ancestry information back, knowing where your ancestors come from. So you get that type of information, but you also get information on if you're likely to get a specific disease or not. So that's the type of information that you'll receive back. And then, of course, as researchers study the data, they will share their discoveries from the data that is being used. From that, they call it the researcher workbench. So just going back to the slide again, so there's like two different ways that you can participate in the program: participating as a participant, sharing your data, sharing any information through surveys or biospecimens. But then there's also another way in which you can participate as a researcher. So those that can apply to be part of that researcher workbench that I had mentioned, they can be part of this study to, again, make those discoveries. So there are two ways to participate. And then the slide is just, again, showing that there are certain diseases or certain like cancers that are more prevalent in the Asian community, Pacific Islander and Native Hawaiian communities. For example, hepatitis, it is 3 times as likely to suffer from hepatitis A, and 4.5 times as likely to suffer from hepatitis B. That's at the bottom left corner, bottom right corner with diabetes. For Asian Americans specifically, 10% more likely to be diabetic than the white population. So just some fun facts, some statistics, that can be jarring to some folks if you have not known this before. So I will go to the next slide. Again, why is All of Us important to ANHPIs? Briefly mentioned earlier in this presentation that Asian Americans, Native Hawaiians, and Pacific Islanders are growing at a pretty fast rate. So this is as the fastest growing population as of 2010. So by 2065, no racial or ethnic group will be the majority. And this is comparing total population and foreign-born population. But as you can see, Asian specifically, they're growing at a pretty accelerated rate. And next slide. And then in the next piece of this presentation, are we present in research on these disparities? So right here in this graph, you'll see that there's both the Asian Americans line and then also the Native Hawaiian and Pacific Islander line. So even this, you can see that even less than 2% of the NIH funded pulmonary studies. So this is specifically overlooking pulmonary studies from 1993 to 2013. Less than 2% included AA and HPI participants. And that's a pretty significant numbers, low significant number in comparison to the other populations that you see here on this graph. So again, AA and HPIs are not represented in research historically. And our absence from research, it's troubling when treatment is developed. As you can see from the rest of the world, Asians make up 16%, and in the United States, only 2.1% is represented in research, specifically in the US. So this is a pretty jarring fact to the second bullet on this slide. The widely successful drug, a heart drug, specifically Plavix, was developed mostly among whites. So mostly whites were involved in this research for the treatment of this, for the development of this treatment. Yet it was heavily marketed in Hawaii, despite being ineffective for 45% of Asians and 77% of Pacific Islanders. So if they were to have, Asians, Native Hawaiians, and Pacific Islanders included in this treatment, that ineffective percentage would not have been as high. So again, our presence in medical research is essential to the future of our health, and that's essentially what the All of Us research program is its goal, is to make sure that all communities are represented in this specific research program that is over a 10-year span. And it is working to be the biggest database of biospecimens, of surveys, of participant data, because it goes over the 10 years and because the goal is to reach 1 million participants. So again, we want to make sure that Asian Americans, Native Hawaiians, and Pacific Islanders are included. Of course, along with them, we want other marginalized communities to be included in that research. We have a lot. Asia in general is made up of so many different cultures, individuals, and background. We want to make sure that all of those types of individuals are included to make sure that medicine works for as many people as possible, and that it's not a one-size-fits-all. So I do have an open discussion. I have a couple of questions, but I did want to just open it up to the bigger group if you had any immediate questions. On the All of Us research program, I also wanted to drop the site of the All of Us research program on where people would usually sign up and join the program. I do want to mention what is a huge barrier with the program itself is that it is only available fully from beginning to end in English and Spanish. And that is a very, very big barrier, especially for our communities. I'm Filipino, so a lot of my community members, they don't always have English as their first language. So going through this type of process is pretty intimidating, and it's hard to even join something like this, especially with, HIPAA information involved and a lot of, consent forms that are involved. So that's a huge barrier. We only have certain promotional materials available in Korean, Japanese, traditional and simplified Chinese and Hindi. And right now, as Asian Health Coalition, we are working with the NIH to really push for a better enrollment for various communities, because this is not just a problem for Asian communities, Native Hawaiians and Pacific Islander communities. It's a problem for other communities too. So there's a lot of trying to think of any at the top of my head, but there's so many other communities that don't have English as their first language. And we wanted to make this an all of us program and not a some of us program. So that is a huge barrier. And I want to call that out immediately because it sounds great on the surface, right? But there's always going to be problems with research if we don't call it out. But I did want to open it up to the larger group if you had any immediate questions or clarifying questions or comments. Or Moon, if you wanted to add anything.
Well, go ahead.
I have a question. So if we'd like to involve in this the all of us, like, and then you said there are like different ways to get involved, which is like the first is like as a participant and second is like as a researcher and etc. So I'm curious to know, like, is there any like a different ways to get involved, like or is there like a particular way that we just like emailed you, and how is it different, like depending on, I guess, the purpose or how are we gonna be as a participant?
Yeah, no, that's a great question. And I think Moon almost basically took that next step, joining the community-based organization training. So more just learning about the program and then obviously in more detail what the next steps, enrollment, what that results of the data looks like. So Moon did go through that training. So in your question specifically, Haley, researcher, participant, and kind of what Moon, myself, and then various partners that we also collaborate with, there is that engagement and education piece. So really just kind of being that voice about research in general, like what that looks like, how underrepresented Asian communities are in research, how underrepresented Asians in like these health systems in general, and these bigger leadership roles. So that's something that we always tell our partners is that education and an engagement piece, how we can just educate them, let them know about this, that it is going on, and we want to make sure that we're involved and we are working towards the future of the health of Asian Americans.
So for me, this summer semester, I studied a new course called Health and Social Work. So I taught my students regarding this issue. I brought up the idea you gave me during my training. So Asian Americans, they are underrepresented in the research area, especially health research, and it affects their health a lot, something like that. So, and my students learn about that, and I encourage them to announce this to anybody something like that in the community. If you know any Asian American, so encourage them to be involved with any research program, especially all of us research programs, something like that. And I also talk to my church members regarding this, educate some of my church members also. And also, as we know, we host a meeting like this today. I believe so we are common members, researchers and practitioners, and they can also deliver the message to the community, to the patients or clients, or even students, right? So that's what you want, right?
Yes, and I think, of course, like joining the program or being a researcher in the program, that's obviously will be great for the NIH, for National Institute of Health. But I think that education piece is just as important, because it goes outside of the All of Us research program, right? So the research in general, when you're setting up your research program, setting up that just the infrastructure of it, usually it doesn't have that diversity mindset in place when you're setting up research, or not all research is done that same way. So I think that's always something to educate people on is making sure that we're included But I know all of you are doctors, researchers on this call, so I do highly encourage if you are interested in looking at and joining as a researcher. I think it'll be such a great opportunity just to get access to more Asian and Asian American data. I guess over the years, we're trying to increase that number, of course.
I have a question. I'm not really sure it's an appropriate question for this forum or not, but as all of us know that the within Asian population, Asian and Pacific Island population, there's just subgroups. Each country has their own culture, should I say subculture within the Asian population. And when you study, you can't just generalize Asians and such, because we are so different. It's changing to the point that I think the last time I got the information was 27 subgroups, or it could be more. Now, the problem that a lot of researchers faced, especially I only know the Korean researchers, when they applied to the NIH grant, one of comments they will deduct the scores is that you can't just target the Korean population. How would you generalize this information to other Asians? So that wasn't just one or two cases. I've been hearing that consistently. And then when I sent that application for the NIH grant, I had the same kinds of comments. So I found that within NIH, there's just some issues in terms of their misconception about the Asian as a one culture, or it's a generalizing Asian in the Pacific Islands. It's grouped it. So any comments on that, your knowledge, or
Yeah, no, Kunsik, I totally agree with you. I think you're calling it out what it is, right? I'm not disagreeing with you at all, because, and it's pretty sad, right, that we are, as Asian Health Coalition, we are also trying to represent Pacific Islanders and Native Hawaiians, and Pacific Islanders has 20 plus other communities that are also included in that. And then of course with Asia, they have even 20 plus more subgroups. So that's what's hard, is that or I guess that's why Asian Health Coalition works with various partners. We don't just work with the Korean community, we don't just work with the Chinese community. We try to have all various partners involved and educated in this All of Us research program, so that you all you have the trust built in your communities already to provide this information back out to the community members, because I'm not equipped to talk to the Korean community as a Filipino American, and then my colleague, my director, the program director, she's Chinese, same with her, right? There is a disconnect there because we're not all from the same community. And I think that's something that we always try to push to the National Institute of Health, like especially with the language barriers. Like they always ask us, if you could choose one language to fully translate from beginning to end for the All of Us research program, which one would you choose? And like, we don't want to just choose one, because that's not representative of all of the AA and HPI communities, because there's so many of us, right? So I think that is very valid what you called out, Kunsuk, and I think that's also what you'll see in, I'm also going to put another link in the chat. This is publicly available data from what's currently in the All of Us research program workbench. As you see there, it is, I think currently it is only Asians that is put into like one category, but it should be more disaggregated than that. As there's more and more participants joining, that's the goal, is that it's going to be more disaggregated into more subgroups, so not just the Asian population. So I think ideally we would like there to be thousands of Korean community members as participants, so that way you can see the data of the Korean population across the US. That would be the ideal situation. But thank you, Duke. I appreciate that comment.
I have one more question for you. So I think you guys also have a survey when you get the data, right? So if so, in the survey, in the All of Us research program, they ask about the nationality and race and ethnicity. Like, do you speak Korean, or are you Korean? What is your nationality? Something like that. Do you think they have question?
They have questions like, is English your first language? So I'm a participant in the program and I still haven't gone through the survey. So if I'm going to be upfront about it, I have not even gone through all the surveys myself. And to be completely honest, it's a lot of surveys, or it's a lot to go through to even get to the next step of potentially donating biospecimens. But yes, I do want to say that that is a question. I think I already answered that question when I went through my surveys. Is English your first language? That's yes. Does that answer your question, Moon? I don't.
Yeah, I'm curious if we can have the like a subgroup data. Like I mentioned this before in the training. So if I'm interested in like a Korean group and their health, yeah. If so, yeah, I want to really focus on only Korean population, and maybe I can I want to compare Korean group with other Asian groups. If so, I need that kind of question in the survey as a variable. But anyway, as a researcher, I'm curious. But,
yes. And I don't want to give you a yes or no answer right now, because I think I want to take that back to my team to see if that's actually a question that's presented. I want to say it is, because I feel I've seen other papers or other potential papers that talk about that, but I don't want to give you a yes or no just yet.
Okay, I'll participate in as a participant soon to see the question.
But going back to your question, there's a survey section, and then there's an option to give biospecimens. So blood, urine, I think it's blood or urine, or saliva. And it's not required for participants to give biospecimens. I know, especially in a lot of Asian communities in general, like that type of information, or that physical thing to give to the NIH, that's personal. So I know that's not something that's required. I know we have participants that just go through the surveying and they stop there. But you could still be part of the research program, and if you don't get biospecimens. I did want to mention that.
Thank you.
I think Hyunji had a
Yeah, I had a hand down. Thank you so much for pointing that out. So, first of all, thank you so much for your presentation, Samantha. I was just wondering, about one thing while I was browsing the data browser website, and I was wondering, if this program will, or is considering including more behavioral health data in their system, because I've noticed that many data here that they currently have is related to physical health. So I was just wondering about that.
Yes, actually, I have been on calls so that's why the program is for a long period of time, because as you go through the initial surveying and if you are to provide biospecimens, as you're in that program for months, years, they do send out like follow-up surveys, follow-up questions. And right now I have been on calls where we are trying to push out a mental health surveying. Right now we're going through making sure it's culturally and linguistically appropriate for all types of communities. So I know that is something that we're in the works. But I appreciate that question, because I think those are the types of questions, and if it's mental health or if it's another area, we want to make sure that those are the types of questions that the NIH for the All of Us program is going to be pushing out. Thank you for that question, Youngji.
Thank you.
I have a question for President Moon.
To me, okay.
So what is Kabha's involvement? And now we had Samantha invited as guest speaker and presenting the whole program. So what is Kabha's next move?
So we learn about all of us research program. I don't know. So what is the best option? Do we have to advertise this to on the broadcast or do the newspaper work? I don't know. Do we have to do that?
Totally up to you, Moon. Right now, after this engagement education event, that is actually the, that's the requirements that we had discussed
Yeah.
previously.
That's what
It's up to you all. Obviously, it's capacity too. There's if promotion or marketing is not within like Kabha's capacity, it could mean like coming back like months later, reconnecting and seeing how you want to include this in like any programming, or if you want to have like myself or my program director Sia Chi come back as guest speakers once in a while. We are happy to do whatever is within your capacity.
So one thing I thought about is adding your program information to our Kabha app's website, but we have to talk about this with
I
our
realize
programmers.
that, yes, we
Yeah.
do need more time to discuss about how we can take advantage of this type of program for the benefit of the Kabha. And then I'm gonna turn the question to Samantha. You've been doing this with other organizations, I believe, right?
Yeah, so right
Okay.
now, our partners that we work with, there is a total of 22 across the nation that are formally partners under the Asian Health Coalition. And then Moon, who had joined the training session, there have been multiple other partners that just joined the training sessions to be informed of the program.
That's great.
And
And can you share with any example of other organization you found that it's, yes, that's what I really wanted to see happening, that kind of example as of yet, or is too soon?
in terms of those that are not partners under the Asian Health Coalition, or those that just joined for training?
As a coalition, yeah.
Okay, yes. So a lot of what our partners do, it's usually their programming goes on as normal. So those that have like regular food drives, or they have like regular monthly education events, all of those types of events, they go on as normal. But what they do is just integrate the all of us piece in all of their programming, maybe not all of it, those that just might make sense. So that may include just adding in a flyer of the all of us program in whatever language that is most suited. It might not be available in all languages, but they would add that flyer, or they would add like a QR code to send to the All of Us Research Program's website. So something as simple as that, or it can be where a guest speaker does come in and provide a full introduction of the program. So we've had various
Different
ways.
stages of, depending on the organization, that basically that's what you're sharing. Thank you.
Yeah.
I'm just curious if this is, I know this is not it's been around for a long time. This is kind of new as far as I know. And it's really wonderful that NIH is interested in it, and also acknowledge that the Asian and Pacific Island populations are under, in terms of getting benefit from their studies as they're coming out. As you mentioned earlier, that most of subjects that researchers collect is the white. So how does that apply to what kind of benefit Asian and Pacific Islanders get is a still big question mark. And I hope that starting this type of program will help to some of the Asian population and benefit. Kabha is especially focused on mental health issues, and that's right now is a major, not only United States, as globally, it's a major problems due to the pandemic and the war in the Ukraine and Russia. It's a major issues. It's going to get worse and worse. So I think it's important for the Kabha to take benefit of what you're presenting at this point. So I'm just curious if Mr. President had any sort of idea since we went to training, and how do you see Kabha's future with this particular program? But time will tell, right?
Yeah,
Yeah,
time.
and we can have more conversations too, to see what makes sense for your organization, and it might not be right away. It could be like months from now too. Of course, I know everyone is working professionals outside of Kabha, so I think that's also something to be cognizant of. We do have partners that have full-time jobs outside of the community-based organization, so we also just want to make sure we're helping you out as much as, you know, it's a two-way street, basically. We want to help you out as much as we can.
Thank you.
Thank you for having me, Moon. I appreciate it. These have been amazing questions, and I know there's probably a lot more as you maybe look through the website or the data browser a little bit more. I'm happy to drop my email in the chat, and Moon, if you also wanted to provide my email to the call, I am happy to share it, and feel free to email me with any additional questions and continue the conversation.
You know what, Samantha, by any chance, can you actually send us a pamphlet, and then information about your research, because we can actually disseminate by our organization email, so people might actually really interested and then involved in your research. And also actually we can utilize our Korean media, right? So I mean, you know, there are, you know, kind of several ways we can really promote your research. So yeah, in the pamphlet or your PowerPoint, you know, whatever. Yeah, so we can get actually kind of better idea what it is. So
I actually have your, I think, yeah, you shared that, right, Samantha?
I did. I can reshare it to you, Moon, via email. There's four pamphlets that are translated in Korean.
Yeah. So yeah, I got that. So we can use that for announcement. Yeah.
Any other questions or comments that I can address right here?
So data browser. So it's, if any researchers interested in data, so I think data is available, right? So publicly.
The data browser that I had sent on the chat is the publicly available data. If you register, I think there's a registration button at the top right corner. That's where you'll get the full access to the data. There's like different tiers of data that you'll get once you go through the registration and like the training process as a researcher under the All of Us program. So if anyone is interested in going through that process, I'm probably not the best person to talk to go through all of that. We do have designated individuals that are in the All of Us program under the NIH that can walk you through that in more detail. So if that's also an interest, we are happy to make that connection.
I have a chance to take a look at the data. I mean, not whole data. So I found some interesting data that that I may use in the future. So I believe some researchers at Kabha. So I believe in this room we have like 5 researchers here. So they must be curious yeah, how to use that. So yeah, check out the data browser, the website that Samantha shared. Okay.
Great. Feel free to email me with any questions. I am happy to assist you in any way I can.
Thank you so much for coming.
Of
So I'm
course.
so glad. Yeah, if I have a chance, yeah, I will invite you again.
I'm happy to attend.
Yeah,
All
or,
right. Thanks, everyone.
yeah, or yeah, other professionals here at Kabha, we may can we invite you? I mean, not to Kabha, but other organization, other Korean organization. Can we?
Yes, we are, as long as if we have the availability in our calendar, myself, my program director, are happy to give that, the presentation.
That's wonderful. All right.
Great.
Thank you.
Thank you.
All right, thank you, Samantha.
Thank
Have
you,
a great
Samantha.
night.
Meeting.
Brenda.
Well, Kabha members, you can stay. But Samantha, okay. 와주셔서 감사합니다.
아유, 수고하셨네요, 회장님. 네.
예.
네.
Thanks for coming. And do you have any agenda we have to talk? 없는 것 같죠.